peripheral arterial disease can be pretty subtle. As patients get older and you're differentiating things like spinal stenosis or generalized arthritis or neuropathy from their diabetes from what may just be simply blocked peripheral arteries can at times be very challenging.
There is an overarching philosophy at St. Luke's that does guide our care of peripheral arterial disease patients. I think the most important thing is that we recognize that these patients may ultimately die of heart disease, and the most important thing is to treat their underlying risk factors. Because you can win the battle treating their PAD, but you're going to lose the war if they have untreated coronary disease. So we give them the same preventative care and approach that we do our heart patients.
When you have a patient that has peripheral arterial disease, there's a continuum of that disease state, ranging from little or no symptoms to really severe debilitating symptoms.
One example of an area where we would go above and beyond for our patients is making every effort to try and save their leg and prevent an amputation.
And it's important that you have access to cutting-edge technology that allows you to treat that spectrum of disease.
We are doing things at the Mid-America Heart Institute that very few other places are doing.
Increasingly, patients have blocked arteries that unfortunately just can't simply be intervened in. They can't have stents, they can't have surgery, medications no longer work, and they have wounds or ulcers on their legs that might lead to amputation. We've recently embarked on a trial that replicates a previous trial that we did, where we actually use the patient's own bone marrow cells, re-inject those into the patient's lower extremities to help stimulate angiogenesis or new blood vessel growth.
There are several other things that we're doing, also investigational, that are not available locally. One that we just started doing is called renal sympathetic nerve ablation, where patients with hypertension that are not responding to multiple medications can have the nervous input to the kidney interrupted, and that can give them marked improvements in blood pressure by 30 millimeters of mercury.
The patients that get farther down the tree of care, where they have very limited options, really require focused, specialized attention like can be provided at St. Luke's.
If you're a referring doctor and you send your patient to us for PAD care, you can be confident that they will be getting a state-of-the-art approach to their peripheral vascular intervention.
We're the only center in the metropolitan area and the only center in a 6-state region that has access to that type of technology. That's why you come to St. Luke's.